Hi guys, thought I'd start making some videos. Never done this before, so don't be cruel. I know I don't look the best. I just woke up. My hair's a mess, but at least I brushed my teeth. um, I was trying to do some research on MCTD, which is mixed connective tissue disease. I've been recently diagnosed with that, and recently I mean by 2 days ago. I think it's normal. I'm not trying to self-diagnose or anything like that, but I do think it's normal when someone tells you that you have a particular disease that you're going to go home and you're going to research it, you're going to look it up. If you're like me, you're going to watch YouTube and try to obtain as much information as possible. You're going to read the encyclopedia, you're going to do everything you can to educate yourself in this particular disease that you've been recently diagnosed with. Unfortunately, I couldn't really find anything, not as much as I would like, and I figured, well, might as well make some videos because maybe there's other people like me out there who do have questions in regards to this disease, or I don't know, it would be nice to possibly get to know someone or talk to someone who has this particular disease to pick their brain, I guess. Um, I don't know whether I should get a second opinion, because the little information that I did find out about MCTD, mixed connective tissue disease, is that sometimes it can take several years to be diagnosed with this, and I find it kind of strange that after like a month I've been diagnosed with it. So this is my journey, and this is how I've ended up here. I would say about a month ago, I went to my doctor complaining of a lot of pain, everywhere pain. One day it would be my, the right side. Next it'd be my left side. The following day would be bad headache. The next day would be bad jaw pain. Next day it would be, my feet acting up. Not only that, not only would I have this pain, but I also would have, I'd be exhausted, extraordinarily exhausted, and I noticed that I've been breaking out in rashes quite a bit. So I thought, well, maybe I injured my back, which I did actually injure my back. About 7 months ago, I was in a very bad vehicle accident. I rolled my car, and I ended up breaking my back in 2 places. So I figured, well, maybe there's a disc that's funky, which is causing this, this pain. So I made an appointment with my doctor, and I said, look, I would like if you scheduled me or made the referral so I can go and get an MRI to make sure that my disc and my back's okay, because I've been experiencing, these symptoms. But then I started thinking, well, what would explain the, the rashes and the jaw pain and the headaches and whatnot? So I thought it would be best if she took a blood test, just because I know that when you hit 30, especially for women, that a lot of funky things can happen. A lot of diseases and illnesses can arise when you hit your 30-year mark. So I told her, I said, I would feel good if you took these blood tests. So a week goes by, and she called me and she said, well, you're right. We actually, your ANA came back positive. It was extraordinarily high. The pattern of it was speckled, all these signs and symptoms for something to be wrong or some sort of autoimmune disease was flagging. So she recommended that I go and see a specialist. So she referred me to a rheumatologist. She made it almost like a next day appointment just because of the signs and symptoms that I had been experiencing. So the next day I go in there and I talked to my roomie doctor. Next thing you know, I started breaking out in a bad rash all the way up to my neck, my arms. So he orders additional tests. A week later goes by, and he explained to me that that everything came back good except for my ENA. I guess my ENA was positive, and this particular antibody that was flagging, which is the antibody SM/RNP, came back positive. So he advised that because of my signs and symptoms and all of my blood tests, that it is MCTD, the mixed connective tissue disease. Now, I don't know if that's normal for a doctor to diagnose someone so fast in regards to that. I tried to do my research and there really wasn't anything. Now, what I did find was when you have this particular antibody, the SM/RNP, that most likely you do have the MCTD, mixed connective tissue disease. So I guess my question to you guys is that normal? Is that how you guys were diagnosed? What was your process? How long did it take? And what signs and symptoms did you guys experience? I know for myself, I just really, the pain and the fatigue is just really what sent me in. The not only that, but I just haven't been feeling right, you know, like my head's cloudy, I can't really think, which I know it's pretty big sign of lupus, SLE, which mixed connective tissue disease is an overlapping syndrome of a few autoimmune diseases, which would be SLE, which is the lupus that I just mentioned. Not only that, but the myositis, rheumatoid arthritis, and there's a couple others that I'm forgetting. But what someone, I have a friend who's actually a PA, and what he had explained to me is that MCTD can actually, it's almost like a chameleon where it could, you know, one flare up you'll have signs and symptoms of, let's say, lupus, and then your next flare you'll have signs and symptoms of myositis. But I don't know, is that the truth? I mean, I have no idea, and I wish I could actually obtain more information in regards to this disease, and have it be explained to me in a way that I can understand. So I would just like to know for you guys, you know, from you guys, what your guys' diagnosis was, like I had mentioned earlier, and your signs and symptoms, and what your blood count was, or not really was, but what, you know, flagged in your blood test. So, but, you know, I'm going to continue making these videos just so that it's a good reference point, so I could see, you know, if the medication that they prescribe me is working, and once again, to educate you guys, or not really educate, because don't self-diagnose or anything, but if you're like me and have questions in regards to this disease. So, boy, I've been saying a lot, but my apologies. Hopefully these videos get better as I make them, because once again, I've never made videos like this before. So, if you want, you know, leave your feedback. I don't know if anyone's going to watch these. I hope you guys do. And stay tuned for further updates with MCTD. Alright, you guys have a good one. Bye-bye.